so far? Good morning, good afternoon, good evening, depending on where and when you're watching this video from. My last episode on how I survived a spinal cord surgery. I will always say, I don't want to make a long video because of those of us that do not like lengthy video. So yeah, back forward to where I stopped in episode 3. So I was actually asked by the doctor, the chief, they handed me over to go and get the MRI scan tape because I didn't collect it from where I did the test. What they gave me was the paper result. So he demanded for the MRI tape that he want to take a view of everything. So I went back to where I did the MRI scan. I got the tape, and the next day I proceed back to the hospital with the tape. Although he's not meant to be on duty that day, but for my sake, like he said, he came to the hospital, he came around just to see the tape because he didn't say much concerning my result. As I was crying, he was just, all he did was just stare at my result and stare at me for more than 1 hour. Then at the end of the day, he was like, "Do you have the tape?" I said no. So they are meant to give it to you, go and get it back. So I didn't know that he was scared of the tumor the tumor being cancerous. So he needed to see the tape. According to him, when he was watching the tape, he said initially why I needed this tape was because had it been this mark as he was showing my sister, because I refused to watch with them because I was scared. So it was like, if this mark crossed this side, maybe I would have suspected cancerous. But the way it is, it doesn't look cancerous. It look normal. So let's be hopeful. But in addition, he said the surgery has to be immediately because of the volume of the tumor, that if if it's not being operated immediately, it could damage a whole lot of things in my body. So he wrote out drugs, and he said that drugs has to maybe last for 2 weeks. They have its side effect that he wouldn't want me to even finish this drug before the surgery proper. And the funny thing again, the hospital I went to, it was a government hospital, but they said they don't carry out such surgery there. They don't have the equipment. So I was given a referral letter to where I went for the surgery. So they died to the referral letter, they look at it. Now, the first testimony of my life of all this is that whoever that sees my result felt I should be on a wheelchair. I'm not meant to be on my feet. But as God may have it, I was on my feet. I was walking, in as much as I was walking with pain, in as much as I wasn't walking fast, in as much as I couldn't do so much thing with my leg, but I was still on my feet. Now, the day I took the result to the specialist where the surgery was conducted, they were calling the patient to come in. Meanwhile, I was in there. They didn't even know that I'm the one. At the time, they got angry because already before I was called, they already collected my referral letter and my CD plate, and they watched. So they were expecting someone to be wheeled inside. And I walk in. So after a while, they were now shouting my name. Where is so I said, I'm here. You need to see the shock on their faces. You need to see the reaction. One of them asked me to, please, madam, can you just go out and come in again? I didn't know what it was all about. It was later I realized, go out and come in. They wanted to know if actually I was the one that walked in myself. I went out and I came in, and they gave me a chair and said that they were confused. It was on that point they carried their laptop. They were zooming. Is it not there? There was a whole lot of medical jargons that I could not understand. But all I know is that they were confused based on the volume of the tumor they've seen and the fact that I am still standing. Then after a while, they raised their face and say, madam, there's a tumor on your spine. Are you aware? I say yes, they've already explained to me where they referred us from. So they said okay, with the volume of the tumor we've seen compressing your spinal cord, you need to go for immediate surgery. Now, if you don't, it will keep damaging so many things in your system. But if you go, it will stop further damage. Now, the question I ask, after the surgery, will I be fine? As in with the pains. They said the level of the pains I have now, that the surgery is not going to correct it. That they are not promising me that the surgery is going to correct it. But my faith was intact because I said to myself, my case is different. Because there's something they told me initially, that if you did not go for this surgery, if you had a tumor in your spine, compressing your spine, and it damaged some of your system, after the surgery won't guarantee whatever it has been damaged in the past. But the only thing the surgery will guarantee is to stop further damage. But all this, I said no. If it doesn't guarantee other people's own, if I do this surgery, I'm going to come out alive, and my case is different. My body, everything, my system will be fine. And to be honest, it works for me according to my faith. So, like I said, I will not bug us with a long story, a lengthy video. We'll see you next time in our next episode. Just tell someone to tell someone. My story could help someone out there. It might not be you, but it might be someone you know. Tomorrow or the next time I'm posting a video, I'm going to give a nutshell of how I felt. In fact, not proud to the surgery, rather how I felt, the feeling, the symptoms before it was even diagnosed that I had a tumor compressing my spine. So that if you have anyone around you that feel that way, you know what to do on time rather than beating around the bush. Thank you.